pace of transmission across the 53 countries of the European region is of grave concern. COVID-19 cases are once again approaching record.
Joining us now for more on this story is Dr. Catherine Smallwood. She's the WHO's Europe COVID-19 Incident Manager. Is joining us from Copenhagen, I believe. Dr. Smallwood, thank you so much for being with us. All right, why is Europe seeing a resurgence in infections right now?
Good evening, and it really depends on the country. And as we know, Europe is quite diverse in terms of the different strategies that have been taken and also the level of uptake that they've had for the COVID-19 vaccination. At the regional level, we've seen cases and deaths in Europe increase by over 55% in the past month. And that's largely, in terms of the new cases, it's driven by population groups that remain susceptible to the disease, i.e. those who are not vaccinated. A lot of the time in countries where vaccination uptake has been slower and has reached a plateau more quickly. And with the winter approaching, people moving indoors, fewer restrictions in place for meeting indoors, the virus has taken advantage of that very, very quickly and has moved through the population groups. And we're seeing now a very rapid increase in the older generations, which are those who will end up in hospital more frequently and unfortunately have more severe disease. I
mean, we'll come on to the slow vaccination in some countries, but 55% increase as you're heading into winter, that sounds like it's a really high percentage.
Yeah, it's not good, and we all hoped that this winter would be easier than last winter, but given the complacency in some countries and given the very, very rapid transmission in countries with low vaccination uptake or not significant vaccination uptake, the virus is just taking advantage of the situation that it's in. So we may face a tougher winter this year than we did last year.
I mean, what measures have been put in place then? Because, of course, we are now into, the 19th month of this pandemic. What kind of mitigation measures do you think have been put in place by nations to try and deal with this winter? Because, of course, we all knew it was coming. We knew it was going to be flu season. We knew that this was going to be a really difficult time.
Well, a lot of countries that have had really high vaccine uptake have rightly started to loosen some of the restrictions that have been put in place. And our position from WHO's perspective is that a lot of the preventive measures that prevent COVID but don't prevent normal life should continue to be in place, because we've seen very rapid circulation of the virus even in countries that have had high vaccination, because there are significant pools of people who remain susceptible. But that, of course, spreads, and that spreads to countries that don't have that level of vaccination uptake. And when that happens, it hits hardest in those vulnerable groups. So we're talking about all of the same measures that we've had available to us, plus vaccination, and in combining different things at the community level, at the national level, through public health interventions, testing, tracing, making sure that people who have been exposed to the virus are able to quarantine with the resources that they need to do so. These are all the same things that can be put in place to prevent these very nasty resurgences of COVID.
I mean, you mentioned that Europe is diverse and there's a lot of different systems in place. I mean, one of those measures you're talking about specifically, I guess, is mask wearing, isn't it? And we're seeing a real divergence in the way that masks are worn in different parts of Europe. In the UK, people have largely abandoned them. I was in France recently and everyone on the tube, to my surprise, was wearing a mask. I mean, is that one of the measures? And how do you get that message back out to people that that is such a simple thing that you can do that stops the spread?
That's exactly right. And that may go part of the way in explaining why the rates are so different in France to what they are in the United Kingdom. It can't only be explained through mask wearing, but every little piece counts. And that's the whole point. We talk a lot about this Swiss cheese approach to protecting each other from the virus and protecting ourselves from the virus, where each measure contributes a small contribution to keeping ourselves and others safe. Mask wearing is perfectly a good visible example, and certainly allows people to go about their business, to go to their work, to go to school, taking a very simple, cheap measure that has been proven in terms of its ability to protect against transmission of the virus, both from a source protection, but also from a transmission perspective.
And let's talk then about vaccines, Doctor. As you will know, I think it was in 2019, the WHO said that vaccine hesitancy was one of its top 10 health concerns. That was before the pandemic. Now we've had this pandemic and there are still people who are scared about getting a vaccination. Some for good reason, of course, some for misinformation. How is the WHO trying to, at this point in the pandemic, make sure that the message still gets out and people actually start listening that vaccines are safe and effective?
Well, we've had 1 billion doses of COVID-19 vaccine administered only in the European region, and that's a very significant amount. And it means that we have a huge amount of data upon which to make our recommendations that the vaccine is both safe and effective. Effective, of course, in saving lives from COVID and preventing people from ending up in hospital. So, of course, vaccine hesitancy is real, is an issue, and we are continuously engaging with different population groups, different religious groups, influential people at the community level to get these messages across. Having said that, we don't only draw the line at vaccine hesitancy in terms of the bottleneck in Europe. There's also access issues. There are systemic issues. There are issues with the way the vaccine is brought to the people or reached out, the outreach systems that are in place. And what we're doing is working very much with the countries with low vaccine uptake to understand which of those particular groups that haven't had access to the vaccine yet and what are the reasons behind it, because it's not just vaccine hesitancy. In fact, a lot of people are very willing to get the vaccine, but there are some more practical challenges that also need to be addressed.
Absolutely right. Okay, Dr. Catherine Smallwood, the WHO's Europe COVID-19 Incident Manager, thank you for your time. Busy winter ahead for you, I'm sure. We wish you the best of luck in all of your work. Thank you.